everybody. It's Sherry.
And Dale.
And welcome to Green Nurse Radio Show, Living Our Best Life. Boy, do we have a show today for you. Amazing. Couldn't happen. Perfect timing with the medical cannabis in Massachusetts, rolling out recreationally. We need to keep medical alive. We have the most amazing couple here with us today in the studio. Powerhouse couple, dynamic duo. We have Dr. John Nadolny, 35-year practicing physician. He's the emergency room physician, critical care systems operations director and administrator. Works at the Melrose, Wakefield healthcare systems and the Tufts hospitals. He's also former medical director at Canna Care Docs. We also have his lovely wife, Cheryl Nadolny, registered nurse, Bachelor's of Science in Nursing with over 19 years experience of nursing. She's the former charge nurse of Hallmark Health. She's done hospice nursing, volunteer work. She's recently returned to work after an extended illness where cannabis was a pivotal tool for healing. She's also, I can't say enough about you, Cheryl. She's also currently enrolled in her master's program for psychiatric nursing, clinical nurse specialist. And she's working to obtain her doctorate in nursing.
I hope so.
Yeah. So the story we're going to focus with them on today is how they both completely gave up their medical careers for something that they passionately believed in to help patients live their best life. Welcome to the show.
Welcome.
Thanks for having
being
us.
here.
Appreciate it.
We're excited to be here.
I know. So before we get into the questioning, we have to talk a little bit about us.
Yeah, please.
Right?
You guys.
I know, the ham. I got to give my 2 cents. Right, so Dale and myself and our nurse Jody were the Green Nurse Group, which is a whole health consulting agency, 501(c), nonprofit, where we focus on cannabinoid therapeutics as a way to manage symptoms of chronic illness. We've been really working hard. We've been working with patients in the community. Dale certifies, Jody and I do consultations and care plans, and we're bringing wellness to another level,
Yes.
which is really important.
Yeah.
I also have to talk about, this is really exciting, okay? I'm sorry, I just get excited.
Plug.
Plug. GreenNurse.com is being built right now as we speak. GreenNurse.com is going to have the Green Nurse Library.
It's going to be a repository for information and research, the latest, whatever's available. So you'll be able to go right there. And if you have an issue with, say, a sleep issue, you'll click on that and you'll get all the research that's up to date and available to you, just like that, nice and easy.
Yeah, and not only will we be focusing on cannabinoid therapeutics with those specific issues, but also drug nutrient depletion. Really important when you're taking pharmaceuticals, that if you have an anxiety problem and you're taking specific prescriptions, that you know the drugs that are being depleted in your system.
And it's not all about cannabis. We talk about that all the time. It's biopsychosocial, spiritual. We're looking at the person as a whole. That means we look at nutrition and we look at lifestyle issues, including sleep, including exercise and other things.
Stress management,
right.
And one of, what do we say to our patients when we work with them? What is important to you and how do you want to live your best life?
Yeah.
Let us take you on a journey. Let us help you reach those new levels of wellness so you can live your best life.
So coming soon,
Coming soon.
GreenNurse.com.
Then we have Green Nurse on the Go.
Green Nurse on the go.
Right? So that's another platform that we've been really lucky to have.
And it's allowing us to bring education to the community, right out to the community where everybody is.
Yeah, and Green Nurse on the Go, it's information that you wouldn't find anywhere else. We're bringing patient stories to the forefront because when these patients come forth and share, they look back on what their lives used to be like. And as cannabis as a tool has worked with them, they're able to see how physically, mentally, emotionally, spiritually, and socially cannabis has impacted their lives. And it helps their ongoing healing as well as bringing hope to others.
Yeah.
So with Green Nurse on the Go, these stories and our experiences and how we're working with people in the community is going to be coming to a book.
Yeah.
right?
Yeah.
Green Nurse.
Living your best life.
Living Your Best Life, and our documentary, which we've been filming ongoing. So let's get back to and new projects. I mean,
Right.
there's so many new projects that we're doing. We really want to make an impact on the community. We really want to help people to understand that cannabis is here to stay. It's not going away, and knowledge is power. The more that you learn, the more you're responsible for. Right? So welcome, Dr. Nadolny and Cheryl.
Hi.
Thank you.
Thank you. This show is about cannabis. You guys have an amazing resume, credentials, but let's get into the story of what happened. You know, you were a former medical director at Canna Care Docs.
Yes.
And what year was that?
So I started at Canna Care Docs February, March 2015, I believe.
No, it was earlier than that. It was back in 2013 that you started there.
When the program first opened, were you from
it was
there from the
shortly
beginning?
after.
Perhaps, yeah, perhaps.
Yeah.
In any case, I worked there for many months, and ultimately, one of the co-owners of the company asked for me to please assume the medical directorship if that's what I wanted to do, and I had no problem doing that because I really enjoyed working in the medical cannabis industry. I felt, I mean, there were many reasons that I initially got into it. but-
Yes.
What
What's the story? There's always a story behind why people, you don't wake up one day and say, hey, I'm going to do cannabis, right?
So I knew that cannabis had many medicinal benefits, and my family in particular had folks with cancer, folks with Alzheimer's, right,
Yeah.
Cheryl?
And my brother, schizophrenia.
Exactly, and I knew that there were benefits, maybe not proven at that point, but that's the primary reason I got into it, because I knew it could definitely help folks.
And because we have an
looking at
endocannabinoid system, and with your
Yeah.
expertise as an emergency room doctor, a critical care doctor, you know your body systems.
And not only
Right?
that, but yes, exactly, and a non-addictive medicine could provide the same benefits that a bunch of dangerous drugs currently provide.
Yeah.
But in any case, and a friend of mine was already in the business, and he said, you know, geez, John, why don't you consider joining us and getting into this? And I did, and I just so enjoyed working with the folks, with the patients, the many patients that I saw and certified, and ultimately the then director decided to step down for personal reasons, and I assumed the reins of Canna Care Docs October.
Yeah, it was around October of 2015.
Yeah,
I think,
yeah.
around that time, because at that time John started bringing me in to work with him, just so I could learn. Because as a nurse, it was fascinating to me, and I at the time had been going through my own severe chronic illness, and I just missed being around patients and being around people, and to see all these patients coming in and how their lives had changed, like when you would see them in the beginning when they would come in as a patient and then maybe come back with a recertification, the transformation was unbelievable.
Yeah.
Like that's what got us really passionate about it, is when we actually physically would talk with patients and see what their lives were like.
And it was so
after.
enjoyable. I
Yeah.
just so looked forward to going to work when I had a shift there.
Because when you're impacting someone's life on multiple levels,
Yeah.
there's nothing more satisfying and gratifying as a medical professional
Yeah.
than helping people to live their best life.
And you can't believe how many 70 and 80-year-olds that I've seen and certified,
Yes.
a couple of 90-year-olds as well.
Yeah.
Yeah, we
We
have
get that
a
a lot.
90-year-old.
Yeah.
So we get a lot of
55
patients.
and over
Yeah.
is our big,
Yeah.
underserved patients and the 55 and over crowd
Yes.
that are really new to cannabinoid therapeutics. The majority of the patients that come and see us,
Yeah.
what do they say? We don't want to get high.
No.
Now, granted, they probably don't know what that means because they've never experienced it, but we respect where they are on their journey.
Or they've been using it and they say, I've used it all my life and I want to use it now and I want it to be legal. So it's something that has been helping them for a long time.
Yeah. And it's amazing to us because where we were in the hospitals before, and especially John's department, we don't get to see patients often after they go home.
Yeah,
Right.
that's
We don't get to, you don't get to follow
Quite
up.
true. Yep.
So,
So-
for us to see follow-up stories.
Yeah. So 2015 is when I got into I started working. So at that time, if I'm recalling correctly, the DEA, they were still visiting doctors in their office. So did anything like that happen with you or?
No, at the time, that was the pre-virtual gateway days.
Yeah.
When I,
Oh, okay, so,
excuse me, when I started getting into this, we did paper certifications,
Yeah.
and the virtual gateway didn't come into being until 2016, as I recall. But we were initially doing paper certifications for a while.
And so then it's evolved to the patient gateway from the Department of Public Health.
Precisely, and then that sort of it was the initial changeover was tedious. It required a lot of backtracking for patients who were already certified. You had to go back and put them now through the DEA gateway, and that in itself created a whole host of other issues.
Yeah.
Right.
At
So
the
they
time.
weren't making it easy.
No, they made
Yeah.
No,
documentation
not at all.
incredibly hard for any clinician who was trying at the time, if you remember, trying
Yeah.
to get patients certified. And that in turn affected patients, and it wasn't fair to them.
Well, I'm even seeing that happen now with the pediatric patient
Yes.
population because the pediatric patient population still has to have a very long 27-page
Yeah.
paper document, which they must lug around to 2 doctors. And if their I's aren't dotted and their T's aren't crossed, it gets denied.
And also, Dale, at that time, nurse practitioners could do their own certifications
Yes.
for medical marijuana use.
well, but as I recall, Canna Care was doing it, but we weren't. What we were doing, the model we were using, is we couldn't actually sign the certification. The physician would do that. What we were doing was the clinical visit. We were examining their records. We were giving them their focused exam. And then they would go see the physician and they would sign the certifications.
Sure, but Canna Care and other medical marijuana companies were allowing nurse practitioners to sign their own certificates and certify patients.
Oh, because that was pre-gateway.
And the Department of
Pre-gateway.
Public
Right,
Health
right.
had
Which was
created this.
certainly,
so they could do
certainly
this.
allowed in the state
Right.
of Massachusetts.
And when they opened the gateway, they didn't allow nurse practitioners to register
It's
for
not
that.
that they didn't
Yeah.
allow them to, it just they had no
They overlooked
they had
it.
no
yeah.
provisions for NPs to use the gateway. It was
Oh, so they didn't make the access easy for them.
No.
so they
No,
did not
it-
make the
it was-
access easy. You're correct, Sherry. And when we Canna Care called the DEA, they gave us a workaround for NPs in that the medical director of the company could, the nurse practitioners could use the medical director of the company's credentials to certify patients that they have
right.
that they have seen, and that,
While they were
of
working
course,
on making-
was not cool with the Mass Board of Registration in Medicine. I'm just trying to think. I want to say that when the nurse practitioners were writing paper certificates, it was fine. But when they certified patients through the gateway via the medical director's credentials, that was not fine.
Ah, all right.
Because
So we had cognitive dissonance going on here.
yeah, I mean, what the Mass Board said was that I, being the medical director of the company, was designating the nurse practitioners to certify patients, but that was not the case. And I certified some 5,500 folks in Massachusetts. I was like,
Oh my God, thank you.
You're welcome.
Thank
he,
you.
he certified the most at that time, and this is where it all started.
But
yeah.
it wasn't all my certifications.
Right.
It was the team.
It was the
It was
team.
the team.
Yeah.
You know, the various nurse practitioners would certify patients on my credentials.
Right.
And what that ultimately resulted in was a summary suspension of my medical license
So
By
people
the
don't-
medical
well-
society is.
by the Mass Board of Registration in
Okay.
Medicine.
But you're leaving out what led to this. So what led to this?
Yeah, so we'll go back.
because-
So there's a-
yeah, what led to this is when his suspension came about was right when question 4 we had gotten that on the ballot, and Governor Baker immediately declared war on all marijuana in Massachusetts. I don't know if you remember when we were petitioning for when we were advocating for question 4 to come through for recreational to pass. Governor Baker then just wanted all marijuana out of the state. He was not supportive of medical or recreational. So there was an incident that happened. I believe it was a car accident, and it was tragic. And this young man happened to have cannabis in his system. But as we all know, as nurses and doctors, cannabis stays in your system for 30 days. So they took that, though.
They took that information.
They took that information, the fact that this boy had a car accident and had cannabis in his system, and they said, whatever doctor prescribed this, that's it. His license is being pulled. He's part of the opiate problem. And that was the word they were using in the press conference. They were saying that John was part of the opiate problem because he was referring so many patients in Massachusetts for X amount, like for thousands of cannabis certifications, making it sound like he was being neglectful, making it sound like, in fact, when he had his summary suspension, they brought in a doctor who, in fact, did do something very wrong. It was writing himself opiate prescriptions and opiate prescriptions for friends, and they paraded him in there right next to him as
Oh
to
my
make
God.
it look like
Oh.
you two are part of the same problem.
It was
And it was really not, it was very politically staged
That's
attack.
horrible.
it was
Yeah.
like the Spanish Inquisition
Yeah.
when I
It
was
was
at that
horrible.
hearing.
And as we all know, cannabis is an exit drug from narcotics and pharmaceuticals.
Yes.
So at that
But
time,
period.
were you still working in the hospital system?
So yes, I was. At the time, I was actually the emergency department systems director of operations, and that was for the emergency departments at Melrose, Wakefield, and Lawrence Memorial. And I also did many clinical shifts, and I had a lot of administrative responsibilities at the time. And then this, as Cheryl was saying, this sort of came out of nowhere because, unfortunately, this this tragic accident on one of the Massachusetts highways, it so happens had occurred by a person who Canna Care Docs had certified for medical marijuana use by one of our nurse practitioners. And Governor Baker and the Mass Board of Registration took that as an opportunity to make an example of me.
And try to assault the program itself.
Yes, very much so.
Yeah.
Yes, and as a result, my license was suspended May 2016.
It was summary suspended, which is the word. That's what we tend to give doctors who murder people, who are abusive, who've harmed a staff member. It's the worst. A summary suspension is
Because
safe
I was
for the
in
most
danger.
depraved.
I was a danger
Yeah.
to the public.
And
Oh,
they call
but
them
wait.
public
You're a danger to the public, but you're in the emergency room, but you're a critical care doctor,
Yep.
and you're saving lives. Okay.
And by the way, Sherry,
Oh my God.
at the hearing, when they were grilling me, I was informed by one of the board members that cannabis is a gateway drug.
Yes. And they
To which
call
I
it-
said,
yes.
it most certainly is not. And that resulted in, a heated argument between myself and the board.
Yeah. Here's the thing: is that a blanket statement like that, without the education
No.
or the knowledge to support what you're saying, it's embarrassing.
It was
That doctor
beyond
should be
embarrassing.
ashamed of themselves. For people that don't understand the endocannabinoid system and how it works as a regulatory system to bring homeostasis back to our bodies, it controls all of the other systems in our bodies. They don't know that. They shouldn't be practicing.
They called him an idiot. It broke my heart. They called him an idiot. They pulled us out. We were in the John was actually taking his board certification exams, and I was at a doctor's appointment. And they call, and you know how panic stricken you are as a medical professional. If your medical board calls you, it's not a good thing.
Yeah, I know.
And they were like, you must come right now. He had to leave his tests. They caused him to fail because he had to leave immediately. And we scrambled to get over there. And here we are. And they're asking him questions. And he is they knew nothing about cannabis. Nothing at all. And they were asking him questions about it. And as he's trying to answer these questions, they were calling him an idiot to his face. You're an idiot to believe that. You're an idiot to think it's not
Well,
a
I don't think
gateway
they
drug.
used that language, but yeah, it was,
Yes,
it was
the one-
definitely indicating that.
Yes, the one man called you an idiot.
And that's
publicly.
abusive.
That
It was
is
beyond
abusive.
abusive. And
Abusive, disrespectful.
They
It's
had-
a shame. It makes me sick.
it was so staged. They had news cameras waiting there
Aw.
in the parking lot. She had the board of the chairman of the board of medicine had a change of clothes and like a little hair and makeup lady so she could get ready for her press conference with Governor Baker right after.
And my attorney,
it was
after the
so
hearing, I
horrible.
got to tell you, I felt so dirty being
Yeah.
in that building.
Ugh.
My attorney said, "Hey, we should wait, for this tonight." I said, "Mark, I can't wait here. I got to get out of here.
Yeah.
I got to go home.
Yeah.
I'm not waiting here."
Yeah.
So then Cheryl and I found out when the Globe called us at 11:45, quarter to
Yes.
midnight, and informed.
What? Almost midnight?
Yes, quarter to midnight.
Oh, thanks for the sleep.
Exactly. And
That's how we
my
were
daughter
notified.
happened to be at the house
Yeah, she
sleeping.
was studying for her
you know.
exams, her senior year exams, trying
And the
to sleep,
Globe,
yes.
not the board, the Globe told me that I was suspended.
And actually, how they
Wow.
told him was through me. So I pick up the phone. I have people banging on the door at midnight. Our child is upset. Obviously, she's studying for her final exams. She was in her senior year of high school at the time. And there's this banging on the door, and I'm saying, "Who is at the door?" And then the phone started ringing. And I saw lights outside out front. And I thought maybe it was him because we had not eaten all day and we went through a really stressful day. And I sent him to go get food. And I thought he was outside. And then with that, the phone rang. And it's the Boston Globe telling me, "Mrs. Nadolny, how do you feel about your husband being a criminal?" That was the words they used. A criminal and part of the opiate problem. And he's lost his license. And
Oh
I
my
said,
God.
"No, that's not true. Obviously I'm thinking that your medical board would contact you."
Right.
They said, "Yes, it is. They just held a press conference. Governor Baker's having a press conference right now. Your husband may go to jail. Do you know that?" That was how I was presented with this at midnight, in the middle of the night. And our child being upset and him coming in the door, and I had to be the one to tell him. And that was like just the worst moment of my life.
Ooh, here I go.
That
Because
was the
when
worst
you-
moment of my life.
Because when you're working so hard
Yeah.
to make a difference,
And I worked for
and you
him.
get completely slammed out of the blue
Yeah.
with something
And
that
it
was
wasn't
so
right.
Out of the blue.
inappropriate.
So not only, all of a sudden, I had to surrender my medical license,
They physically made
which
me
is
turn it in.
essentially all I know how to do.
Yeah.
Right.
And
It was your life.
so now
Yes.
I can't see medical cannabis patients. I can't do my job in the emergency department. I can't be an administrator. I couldn't do anything.
They stripped you of everything.
Stripped me of everything.
You come up on every background check if you have a summary suspension as basically like a criminal. It's like doctor jail. They list you as a danger to the public.
And
so even normal jobs.
And we couldn't, back at that time, we were right in the process of selling our home in Everett. We had so much else going on. We had planned to, sell the family home, which has been in the family for some 50 years. And we were going to move away and build something else or buy something else. And all of a sudden we had nothing.
Yeah.
So
It came down to no
Oh
income.
my God.
Canna Care Docs at the time, if it wasn't for them.
Yeah, we would have been homeless if it weren't for Kevin and Mike and Marta and Stephanie and Kathleen.
So thank
So
you.
they really,
They really stepped up to
Came
the
They stepped
plate.
together.
up and helped
We
take
would
care of
be-
you.
They were
We would be nothing.
essentially paying me a monthly
Yeah.
salary
Yeah.
when I wasn't able to work. And that went on
And that's
for,
what the cannabis community does. We
that
take
went
care
on
of
for
our
many
own.
months.
So when people ask me why we support Mike Maloney, it's because Michael came in at that time, and John we'd known him before, but that was when we all really got close to Canna Care as a family. And Michael came every day, called John all the time, always free advice, support, phone calls. If I didn't understand legal things, he broke that down for us. And he literally put food on my table when I could not put food on my table. When I was sick and in the hospital and we couldn't afford medical bills, they all did that.
But
They
the
all
remainder,
helped
but the
us.
remainder of this
Yeah.
tale is,
Yes,
I believe with this July, was it July? We were living with
we had to move in with my
Cheryl's
family.
mom and
yeah, we had
brother
nowhere to go.
up in New Hampshire
Yeah.
for a period of time.
Which
while
actually
we were
was very
preparing to
healing.
move,
Yeah.
into our current apartment. My hearing for this summary suspension was in July,
Yeah, a couple months
July
later.
2016. And the magistrate, in an 18-page majestic beatdown of the board, listed a number of reasons why they should not have done what they did and why I should not have had my license suspended.
And also, he mentioned
Now-
that it was an attack on nurses as well in that
Yes.
in that
Yeah,
statement.
and he, exactly.
He was very upset by that. Yes.
So, given that, the board doesn't have to listen to the magistrate. I mean, they can basically, they're the king and queen.
Yep. They
don't
get to
have
do
to
what they want.
listen to
do whatever
nobody.
they want.
And
Regardless of what they know and don't know.
Right.
Correct.
Which is
So-
pathetic.
several months later, the board finally realized the error of the judgment and granted me they reinstated my license, not without me having to make some. I had
Concession.
I had to make some concessions.
Or they wouldn't give it back to him.
But the goal, as Mike Maloney said, was to get my license back,
Yeah.
which I
Yeah.
did. There's restrictions on it. I can't practice in medical marijuana.
Which is ridiculous because he's an ER doctor who can
Right.
write for morphine, fentanyl, and Dilaudid.
Right, but not cannabis.
But he can't be trusted with cannabis. No.
And
Doesn't
my
make sense.
group was absolutely stalwart. They stood by me the entire time.
Yes.
The hospital stood by me the entire time. So I was, not only had I gotten my license back, albeit with restrictions, but I got my former position back.
So your career wasn't affected in the
His
long
hospital
term.
Well,
career,
it is
yeah.
kind of
Because you were unable to practice for a chunk of time.
correct.
Very long
And
time.
So that affects your
How did that-
physical, mental, emotional, spiritual, social, right? So
correct.
you had to
We burned through a lot of our
All
you know,
our savings.
all of our savings, all
retirement.
retirement fund, sold the
yeah.
house, basically ended up with nothing,
Yeah.
starting from scratch
So we're-
at age 59.
We're starting out in life again. It's kind of like being in your 20s again, but it.
So yes, I consider myself fortunate that I have my license back. But it's a different world now compared to
When it was
2
done.
years ago. Yeah.
Yeah, and he was out of practice for. Can you imagine? And I know what it's like too, from just being ill and going back, being out of practice for 15 months as he was, and then having to come back like nothing happened. He was so nervous the night before. He said, "What if I'm rusty? What if I don't?" And he got back and he was absolutely
I didn't lose my
fine.
fastball.
He didn't lose anything.
Yeah.
So what about the
But-
culture of the hospital, of your coworkers? How was that going back?
They were all and remain pretty annoyed that this even happened.
Yeah.
So they were in full
they're
support of
very,
you.
very much in my
100%,
corner.
Yes.
Yeah.
So the hospital system was in full support of
Full
Dr.
support.
John Nadolny.
Yes.
Yeah. And everyone.
And it was the system that doesn't understand cannabis as a
Mm-hmm.
tool, cannabinoid therapeutics, that took away your license unjustly.
Yeah. But it's turned into a positive. I mean, yes,
There's
we
a
have
silver
negatives.
lining. There you go.
There is, because this opened this big door when he came back, and then I said, well, I'm ready to come back. And what happened was, when he lost his license at the time, we had plans I was going through at the time. While I was sick at home, I said, I might as well do something with myself. I'm going to study to become a nurse practitioner. And obviously, when we lost our only income,
That went out the window.
yeah, that got delayed. And going back to work, when I tried to even just go back in nursing, and I could understand it. The hospital felt uncomfortable with that.
They
with
even
me.
felt uncomfortable with you.
Yeah. Well,
Oh,
and
wow.
a lot of hospitals did, because at the time I was so loud and vocal trying to help him. He could not speak about what was going on with him. So here I kept coming up, speaking about cannabis constantly. And of course, until very recently, hospitals did not care for that. But after this happened and he got back, and he got back into his career, and I started coming back in, we have people every day now in the hospital, surgeons and everything. When they want to know something about cannabis, or they want to maybe get a patient off opiates, it's every day that we're being asked about it. It opened the door for the conversation to
Yeah.
make it okay. Because as the hospital saw that that everyone supported him,
Right.
and that they were okay with him being a cannabis practitioner, the taboo of it went away in our community hospital, which I thought was pretty amazing.
So are you seeing a lot more providers, nurses, and physicians seeking out education for cannabis? Because
Yeah.
I know the Mass Medical Association at one point, I don't think they have it now, but they had the education on there that you could purchase through them, that you could get CEUs for. Now they go through the answer page.
The answer page, yeah.
So do you see that now in practice? More providers looking to get educated?
I don't think so. I
Not
mean,
enough. Yeah.
certainly not
enough.
enough.
Yeah.
I
Green
mean,
nurse on the go.
I have to tell you,
They need us.
Yes.
my primary care physician writes his own marijuana certifications and has done so for about as long as I've
Yes.
been in the medical marijuana practice. So it's certainly not taboo, really. But,
Right.
but a lot of docs will not be very willing to discuss
Right.
it, I would
Is,
think.
is it because they're afraid?
Well, yes.
It's
Maybe,
fear. So
maybe.
they're
Well, they look at what happened to him and they say, "Oh my gosh, what?"
Right.
You know, and that's why they did that. I feel
No,
like
you know-
they did that.
you know
They
what
made
though,
an example
Cheryl? I
out
mean,
of you, but
But it wasn't because of the medical marijuana practice that I got suspended. It was because of something that happened that the state capitalized on.
right,
Yeah.
because they wanted to paint a negative image of marijuana
right.
or cannabis, and they wouldn't use the word cannabis. No matter how often we tried to correct them on that, they just kept calling it marijuana. But they wanted to paint a very negative image
And I was just so
about
incensed.
all cannabis practices going into
When-
that election.
And so they were creating a fear propaganda campaign for any doctor or medical professional to go into the cannabis industry. They were pigeonholing you in one incident that we know it was tragic, but you know what? As we also know, cannabis stays in our system for 30 days.
30 days.
So it
yes.
was, so they were setting you up and the medical professionals up, fear mongering, right?
That was before question 4, right?
It
or
was
is it
before
around the
it
same?
passed. It was right as we had it on the ballot.
So they were what? It was a political issue.
It was a very much, yeah.
'Cause-
yeah.
I was so incensed when they called cannabis a gateway drug.
Yeah.
Like, are they serious with
That's
that
what they've been
statement?
telling us for years, though,
For
trying
years,
to scare
they
us
say.
and scare our kids into not trying it.
And the one physician was saying in the middle of this hearing, so here's this doctor who wrote all these prescriptions for opiates to himself, which, as you know, is absolutely appalling. And they barely asked him a question. And they just grilled John intently for well over an hour and kept saying, are you aware that cannabis and pot causes psychosis? And do you think that that's okay, that you're going to be giving these drugs to people and that they'll become psychotic?
Well, here
I
it
mean,
is. Bottom
was
line,
reefer madness.
I'm not giving drugs to anyone. I'm certifying.
And
Right?
and we were, our faces in that hearing, we were dumbfounded that people still believed this. But
Now,
But these educated people, they kept using the word prescribed. You
Right.
prescribe medical medicine?
No. That's where
So
the
there's
missing
a
No,
little
link
bit
I
of-
certify folks so they can use
so did you
marijuana
lose
for
your?
medicinal purposes.
Did you also lose your DEA license?
So that was, fortunately, that didn't happen.
Were you called to question? Was that called to question as well?
No.
Oh, that's
And I'm not, frankly, I don't know why that,
Yeah.
why my DEA license wasn't revoked. Maybe it was an oversight, I don't know.
the
but
state doesn't talk to the federal
Maybe.
government.
Perhaps,
Shocking.
Talk about
I know
communication
my
problems.
state, my Massachusetts Controlled Substances registration expired
okay.
in the interim. But my DEA license had not expired,
Oh,
so I just renewed it
yeah.
after my license was reinstated.
Good.
So, one of the things that we're seeing now, fast forward a couple years from this, is a lot of providers, we're getting referrals from providers now, from physicians,
yes.
psychiatrists and doctors. And in the beginning,
Really?
yes. So in the beginning, we would get a few from an oncologist here and there, and we would say, okay, they understand the benefits, and the patients that, they need something, this is not effective.
That's extraordinary.
But now we're getting psychiatrists are on
Integrative
board.
functional health doctors. Remember we met with Dr. Delaney?
Wait, Dale, you're getting referrals from psychiatrists?
Yes.
For what conditions, if I may
For
ask?
depression, anxiety, yeah,
PTSD.
and PTSD. That's
Insomnia.
another big
And
one.
the Mass Board was so against
But they
folks
see the
using
benefit.
medicinal
Yes.
cannabis for like psychiatric diagnoses.
But what we see, right? But what we're seeing is, I'm getting my doctorate, and I just did this research quality improvement project, screening patients for depression. So people that have chronic pain, as you know, are likely to have depression comorbidity, and talking to patients, they've been on they're scoring really high on the depression scale, and they're on antidepressants
That aren't
15,
working.
20 years, and they haven't changed them. There's nothing that's different. So I asked them, I encourage them strongly to go back to the provider that's prescribing, which is often the primary care provider who's not servicing the patient from a psychological standpoint,
They're just writing scripts.
and encouraging them to get psychological help in addition to this, and to reevaluate the prescription that they're on.
Yeah.
And patients are coming to me and saying, well, my primary care provider is afraid that to take me off of this drug. So they're just leaving me on it, because it's harder to get them off the drug after they've been on it for so long.
Yeah.
Yeah.
So
It is.
I think that's what we're hearing from patients.
Yeah, and,
But-
and the depression too, the part that's very interesting with Dale and I working with this tool is when we ask them if they're depressed, they say no.
Often.
But the clinical
Yes.
score shows that they're moderately to severely depressed and they don't even know it because they're so
True.
used to feeling shitty. Whoops.
And when we work, we work with with somebody that's a referral from anyone that comes in with the mental health issue and they want to be certified, and they've been oftentimes using it successfully, and they're coming in so they can be legal because they feel better about it.
Right.
They bring a letter from their psychiatrist telling us that they've been in treatment for this long, and this is the treatment that this is what they're being treated for. They're not a danger to themselves. They're not a danger to others.
Right.
And I feel this would benefit more than it would harm this patient. So that's what we're getting, and I think it's wonderful, because
Yeah.
I know in
It
the
is.
beginning people were scared to do that.
I've certified many folks for anxiety, depression, insomnia.
And chronic pain. I mean,
Yes.
chronic pain
Right, but
actually
I'm talking
precipitates.
about these psychiatric
Right.
Yeah,
diagnoses
but then the
that
chronic
people
pain.
would say, "Oh, you can't certify for that."
Well, chronic pain patients
Well-
also turn into psychiatric
Yes.
problems.
When you,
Because it's-
but when you go to
very
the
depressing.
the Department of Public Health, what are you certifying this patient for? Mental and behavioral issues is
Yes.
now listed on
which
there,
is amazing,
which
and
is
it should have
great.
been all along.
Yeah, so improvement.
My brother,
We
yeah.
listed those diagnoses back then.
Yeah.
And now they're
And now
official.
they're official. Yeah, and because we've seen it, and we in our family live it with my brother, with Joseph, where he has traumatic brain injury, he has schizophrenia, he has other special needs. He's on the spectrum, and also just severe anxiety and depression and isolation going along with schizophrenia. Schizophrenia is such an isolating disease. There's so much negative stigma. People do not understand it. They fear it. And my brother's just like this joyful person, this ray of light. And
What a turnaround.
and it was horrible, because for a couple of years we lost him a little bit. We just couldn't even. He was just so unsure of himself, and he was just experiencing so many negative side effects from the medications for the schizophrenia, from the brain injury. His depression was profound, and he almost had. If you've worked with schizophrenics before, a lot of times they have a very flat affect. You know,
Because
Yeah.
they're so numb.
no
Yeah.
laughing, no smiling, and that's mostly from psych drugs.
Yeah.
And when we put him on CBD,
Non-intoxicating
yes,
CBD.
CBD, we noticed an immediate change, right? He was laughing.
Absolutely.
We hadn't seen him laugh and smile in like a year, and he was joking with us, and I said, oh my gosh, it's like someone's given him back to us. It came about in about a week.
Wow.
And then
That's
yeah.
that's amazing.
And then we addressed
It
his
is
sleep.
amazing.
He got
I
off.
agree.
He was on a lot of pain medications from his injury. We weaned him off all his pain medications. That was his wish, and he put himself on a higher CBD dominant strain at nighttime, and he's been amazing.
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 When the program first started, the medical cannabis program first started in Massachusetts, it was so nebulous about what you could certify folks for. It was basically left up to the discretion of the certifying physician.
Right. It
Yes.
still is.
Yes.
They
know.
call it the debilitating condition
What-
clause.
what is the debilitating
Yeah,
condition?
and how do we
exactly?
define, which they do define it in the law, so you can see how does this affect somebody's life. And so they do have that, and it is a little bit, they still have those conditions listed, but when you add your own diagnosis, then the whole list comes up, so.
Yeah. Wow.
And we see it, it's incredible what we see, and the number of people that have gotten off of pharmaceuticals. And I don't like, I'm very conservative in terms of what kind of medication. The least favorite thing I ever want to do is prescribe something to somebody. I do not like writing prescriptions for pharmaceuticals, especially when I know that this person could probably make some changes in their lifestyle or
Diet.
maybe, and that this would, I like to do it as a last resort. And cannabis needs to be a first resort. It shouldn't be that I have to take a patient with a chronic condition that's tried everything else, and now they're coming to me for hope. Or they've tried it and say, oh my gosh, I have a friend that has their card and they gave me something and it really worked and I want to try this. And then starting the process of, okay, the next time I see them or we talk to them, because we have a continuing relationship with our patients through care plans, and
Ongoing continuity of care.
And in
Yes.
conjunction, not always directly with their provider, their primary care providers, but always with the recommendation that they wean off of medications with the prescribing provider.
Yes.
Yeah.
Because we don't want to step on anyone's
Right.
toes.
Right.
We don't
Right.
want people to come off at such a pace that it's detrimental to their health, is going to cause more issues.
And that's what we've done with
Yeah.
patients that have come to us and have said, listen, I want to come off my pharmaceuticals. I say, well, that is the job of your doctor. We will help to manage with education for you to take the appropriate type of cannabis to help you through that process.
And mostly it's mitigating side effects of coming off of medications that they've been on for too
Yes,
long.
yeah.
So they're having side effects from that.
Now, Dale, are NPs now able to certify folks through
Yes.
the gateway?
So now there's an option, and I'm not sure, first you have to call the DPA, Department of Public Health. They don't give you an option just to sign up. You have to call
So
them
you can't
first.
get a gateway account,
But now you can get a gateway. As of,
but
they
you
did,
have, you have to speak to a human, though?
yes.
you just speak to a human.
So you have to go through the process,
Yeah.
and it's a little bit, but but at least we can register for our own account, and it makes it a lot
And
easier.
as of when?
As
when-
of last November, but it wasn't announced, so you had to just know.
Yeah.
So they
made
kept
Right.
it secret,
they
they
made
kept
it
it
very
private,
Yes.
they didn't want people to know.
Yeah,
And that's what the judge was saying, the magistrate was saying in his case, that this is just, he read the nursing law and he said, this is a blatant attack on nursing. And he said it over and over that day. And it really truly was. And they really,
Yes, the board said, NPs cannot, in fact, certify patients, and we, my attorney and I, gave them the legislature that allows NPs to certify patients
and,
and it's
for
amazing.
use of medical marijuana.
and now, this is
Now,
exciting.
yeah.
Now, I get phone calls out of the blue from nurse practitioners I've
Yes.
never met, and asking me, how can I offer this to my patients? How do I get trained for this? Can I come and meet with you? And I'm like,
Isn't that great,
yes,
though?
of
Same
course
thing
you
with
can.
the registered
I love
nurses
it.
too.
Yeah.
Registered nurses, people are coming
Yeah.
out of retirement.
Yes.
Nurses that have retired
Mm-hmm.
are now that they are learning about the endocannabinoid system and the benefits of what cannabis can do as a choice. They're coming out and they want to do it. It's
Yeah.
like they have a I'm freezing. Ooh, sorry. It's sweater weather.
Sweater weather.
I need a sweater.
So it's very exciting that more nurses and nurse practitioners and physicians, I get calls
Yes.
from physicians, I get emails, and occasionally they'll say, I really want to offer this to my patients, but I just don't have the time to learn about it, and I feel
Right.
it's irresponsible if I can't do the research. So
Right.
can I send my patients to you?
Sure.
Absolutely.
Interesting.
Which is why
because
we need the
You
medical
need,
groups.
what, like 2.5
Right.
credits?
But they still,
to be able to
it's not a
certify?
lot. So when
Yeah.
to be able to certify those 2.5 credits is 2.5 hours of your time, which takes half of that.
But I still think that folks are reticent to
Yeah, we have a ways to
to
go.
want to,
Yeah.
take on that responsibility of certifying patients because of fear of retribution, I guess.
Yeah.
But the talk is the more positive talk about it is around the workplace
Right.
now,
And,
which
the-
is a
and the more
positive.
stories that we can get out there too, even though
Yes.
it might be anecdotal, research is coming. The more
Yes.
stories we can get out there, what they've been experiencing and how their lives have been impacted from what it looked like before they were taking it to what they look like now from taking it. You can't ignore that.
Right.
No.
You just can't.
And
I would guess that probably every single patient I've certified can give you a positive story about
oh
that.
yeah.
There isn't one patient
Yeah.
that we haven't been able to help improve the quality of their life.
In
They've
some way,
changed
it's not
their lives.
always in the way that they thought it was going to be.
Right.
And sometimes I say to patients, it's not a magic pill. It
No.
might not take your pain from an 8 to a 0, but if your pain goes from an 8 to a 4, your
Right.
quality of life is going to be improved in so many other ways.
Absolutely.
Oh, if it didn't touch your pain, but it helps you to sleep, the quality of
Exactly.
your life is going to improve. And the other thing, but the exciting part is, I'm still getting calls to speak to medical professionals, and Sherry and I don't know if you know this, we both went to Boston College.
Yes.
Go BC.
Yeah.
And we they
Lectured.
asked us to lecture there
I saw
to their
that.
graduating nurse practitioners. So we did that, and then this year they want us to come back every
Every
year.
year.
That's great.
So
Yeah.
for such
Boston
a
College.
who would have thought, right? But
Right.
it's
Go
really
Eagles.
the responsibility and the most exciting part was that when I asked every provider in there, all these rising nurse practitioners, if any patients have they've been asked about cannabis, 100% of them were.
Yes.
Yeah.
That tells me that it's
Yeah.
out there. This is something that we need to offer to nurses
Right.
and to nurse practitioners and to physicians, even a basic knowledge so that they know
Yep.
who, just a little bit to talk about it and who to refer to. In the
Right.
same way that me as an adult gerontologist wouldn't give somebody, I would refer to a cardiologist. I wouldn't
Exactly.
try to give
Yes.
all that
Yeah.
information.
Yes.
So as long, because we know our scope of practice.
Yeah,
Right.
as nurses, we do. And what about
Yeah.
the time too? We did a presentation for hospice social workers and
Yes.
registered nurses. There was
Yeah.
over 50 of them.
Care managers.
We did a
have-
2-hour lecture, and at the end, I asked them all, "How many of you think that cannabinoid therapeutics may help your patient population?" Every single one of them raised their hand.
And in hospice, because in hospice, we've used cannabis forever, back to the dark ages. That's a secret of every hospice nurse I know. So for us, that's been going on for a long time, because you're at that point, your patient is dying,
Yeah.
and you should be able to do when you are
And anything you
dying
want.
anything you
Right.
need to
That's
make
what
yourself
it is.
feel
Is
better.
this is with hospice patients.
It's
I
care
did
and
3
comfort.
years of hospice
Yeah.
nursing, and the bottom line is this: it's the same thing. I asked them, "What is important to you at the end of your life? You deserve it,
Yeah.
right? You deserve."
It's all about
Yeah.
quality of life.
And so I bet, like, the hospice nurses know, and they've been screaming that from the rooftops forever. And I'm glad to start seeing the other nursing institutions picking up on this. Like Regis College, when I went in for my interview for my master's degree program, and they were sitting down and we were talking about scholarships, I actually had a Catholic nun, one of my former Catholic nun deans of nursing, come to me wanting to know about cannabis.
We have
We
a
have a
nun.
nun.
Wanted me to study
We
it.
have
do.
a nun.
We have a nun.
She
believe
yes, basically
Yeah.
PhD, 30 years teaching organic chemistry. She basically has RSD. She was on fentanyl 400 micrograms. She has an internal neurostimulating machine that was implanted into her. Her pain was a 9 out of a 10, which we know is a 20 out of a 10. And basically, in 1 month, using full extract cannabis oil and CBD, her pain came down to a 2.
That's amazing.
And
That's
she is
fantastic.
ecstatic, and
But
she's quite the
incidentally,
advocate now.
30 years of teaching organic chemistry in and of itself is enough reason to, put yourself on THC.
Yeah, well,
Yeah.
she was funny. She even said, she
True.
goes, "I am the last person in the world that you would ever think that uses cannabis." And remember, we asked her, we said, "What would Jesus
What would
say?"
Jesus say?
And she laughed and she goes, "Jesus would say, 'Why did you take so long to use this God-given plant
Yes.
Right.
that was
Yeah.
given to
That
us?"
was beautiful.
true.
That was beautiful.
No,
You
that
know,
was
by the way, on a side note, legislative bodies are not very willing to admit the error of their ways ever, because I composed a fairly elaborate letter
Yes.
to the board,
Yeah.
sort of alluding to the fact that, hey, marijuana is now legal recreationally, or is going to be legal recreationally come July 1st or whenever that.
whenever July
When the
1st
date
actually happens.
keeps moving, right? Yes.
and for these reasons and many others, I wonder if the restriction could be removed from my license, and the board council said no.
Wow.
You agreed to this.
Yeah.
Not
They said it's
happening.
permanent. And we put in the
Now
argument.
that and nurse
yeah, it's
practitioners
crazy.
can, legally
Right.
certify folks, and it's a legal substance anyway now in the state. Nope, they wouldn't hear of it.
unbelievable.
And we need to
Can't
keep the
be
medical
true.
program
Yes,
alive. It
we
is
do.
it is of the utmost important, because I don't mind sharing my story. I'm a patient too.
Yes.
And it brings us into, because this hour went by so fast.
Yeah.
Yes.
Basically, we did a show earlier that I want you to go back and watch. Myself, Dale, Cheryl, and Jody all talked about question 1
Yes.
in detail. You need to go back and watch that, because question 1 is really important. This brings us
Yes.
back to nurses.
Yeah.
And you have 35 years experience. You have over 19 years experience. And question 1 is something that people are so misinformed about.
There- and
It's about
this-
protecting
yeah.
patients and the nurses that care for them.
Yes.
And the nurses,
Same.
even the nurses are divided. So there's a
Yes.
lot of information, a lot of misinformation,
Yes.
and it's very close. So we need everybody to get informed
I think
and get out and vote.
clinical nurses may be divided because maybe they're getting pressure from
Yes,
Yes.
from on high.
At work.
and
they
I wanna-
are. That's true.
We touched about this in our earlier episode, but I want you both to make a statement about question 1.
Question 1 is about safety. We are not, nurses wrote this ballot initiative. It is not about us seeking more pay, better hours. It is not about us. We wrote this to keep you safe. We want every patient to feel safe when they're in the hospital. We want every nurse to feel safe when she's at work, or he is at work, excuse me. And we want everyone to be able to, if they press a call light in their room, if you've ever been in a hospital and you're alone and your family's gone home and you might need something, maybe you're in pain, maybe you're not breathing well, maybe you are scared, frightened, need to get up, use the bathroom, you press a call light, how long do you want to wait? If you have a nurse who has 10, 11 patients, you might be waiting a long time, and that can be the matter of life and death for you. And that's why we care enough to try to pass this. This is a safety issue, bottom line.
Yeah, 86%
Yes.
of nurses in Massachusetts approve of question 1.
They do. The numbers are changing because we're hearing, and yesterday I was brokenhearted. I was literally crying. I attended a meeting at the Mass Nurses Association, and to hear on the hotline a lot of the nurses, including nurse managers, nurse supervisors, people who have been threatened, feel like they're going to lose their job if they vote yes, feel like if they advocate for yes on one, that their hospital is somehow going to be destroyed. It's union busting, it's fear, it's intimidation, and it's not fair. That's not right.
That's not how you treat your
educated,
nurses. That is
yes.
not how you treat the
No.
nurses that are caring for the patients, that are
Yeah.
on the front line, that really understand biopsychosocial spiritual healing. Period.
And John
John, what if-
supports us.
Yes on
Yeah.
question 1, John.
So yeah, I mean, to think about it logically, you would think, well, gee, if a nurse on the floor had to care for 5 patients rather than 8 or 9, then the care for those 5 patients would be far better than.
That's
Oh,
logic.
yeah,
Yes.
it is logical.
I mean, that's what you would think. Now, the proponents of each side, of course, think they're right, and think their arguments are valid. This is why you should vote no. This is why you should vote yes. But really, when it comes right down to, and granted, maybe it's handing over control to the government, a yes vote, maybe, to, guide patient ratios, but really, it's best for patient safety. I don't see how
yeah,
that
then,
cannot be true.
With handing over to the government, we've already allowed hospitals
We
the
already-
autonomy
yes.
to mitigate this problem on their own, and they haven't
they
done
haven't
it.
done it.
Right.
Yeah.
That's
correct.
a big dollar sign. I see dollar signs here.
Yep, and we
Yes.
talk about that in depth. So please
Yes.
watch our earlier show.
Yeah.
So as we wrap up this hour, I just
And I
wanna,
support nurses. I support my wife, by the way.
Thank
you guys
you.
are awesome. I just want to thank you both
Yeah.
for being here and for
Thank
doing
you.
all you do for the community.
Thank you.
Thank you for
Right.
having us.
You just
We really
And
appreciate
we
it.
love
Really-
you guys. I
really,
look
really
up to you.
appreciate it. And so basically, I have to plug Green Nurses again because we are a nonprofit. Green
I
Nurse
almost
Group.
shed a tear earlier,
Yes.
by the way, when I was talking about my situation.
But-
Yes,
and that's
you're
okay.
very emotional.
You know
It's
what
healing.
it is?
It was
It
to
is
heal you.
healing.
Yes.
And it's important
Yeah.
because your story is important because there's other people that are out there that are
Yes.
listening to this, and you guys are making a huge
Making a
impact
big
on the
difference.
community.
Don't give up hope. This is a family, although it's put a lot of strain on us, and as a couple, what's come out of it is no matter what the status of our relationship or our family, we all have each other's backs. We were in a foxhole together. And not only us, when I say family, I mean the Canna Care crew too, who was in this with us. We love each other. But John and I, our friendship is we will always be best friends above all and be there for each other. We learned what it was to not give up hope. And
Not
you just
give up
keep-
on each
just
other.
keep
And you
fighting.
guys are fantastic, and
Yeah.
you do great work.
Yes.
Oh,
Thank
thank you.
Thank
Yeah.
you for
Very
what you
much.
guys do.
So we need help serving the underserved, right? So if you go shopping on Amazon, smile.amazon.com, no cost to you.
No cost to you.
You
It
can-
just all comes out. A percentage goes to the Green Nurse Group. You choose Green Nurse Group as the charity,
Charity.
and
And
you
then-
shop as you normally would. And
Yep.
if you're like me, you're getting deliveries
Every day.
every day from Prime.
I love Amazon Prime.
And,
It's
and
like
then
Christmas.
Facebook also has a charity. So you're able to contribute to the Green Nurse Group through that charitable contribution. And what we want you to know is this money goes towards patients. It allows us to go into the hospitals. It allows us to pay $50 for parking so I can go into Mass General and sit in the epilepsy unit taking care of people. It allows us to go to patients' homes. It allows us to do things because it's expensive.
Yeah.
You know, so we really appreciate your support. Next week,
Yes.
do we have a show for you?
You're not going to want to miss this one. I know we say that about everything, but this one is really exciting because who doesn't
Sex.
like talking about sex?
Sex and
Right?
cannabis.
Ooh, that sounds like fun.
Right?
So we have Dr. Jordan Tischler talking about sex, and it's going to be a really great show.
It is going to be good. We're going to really enjoy it.
So stay tuned. Join us.
yes, and remember,
Any
it's-
demonstrations?
any demonstrations. we'll ask him for the videos.
We'll ask.
Right. So thank you all so much for joining us, and remember, it's all about living your
Living
best
best
life.
life.
Before we end, we have a little clip from this past weekend
Oh.
from NECAN. We go to the 4th annual Rhode Island New England Cannabis Conference, and it was wonderful. We were there. We met new people.
Not
Oh,
me.
I
I was doing a
Can I tell you? I was on the
doctoral
horn.
write-up. That's
I was on the horn with you. I don't know how many times,
so
right?
as usual, I'm missing out on all the
So
fun.
Sherry gets to do all the fun things.
But I'm sending you selfies and pictures and business cards.
Yeah, yeah.
Right,
that's
so I include her in everything that she can't be there, and I just want to say thank you for getting your doctorate for us. So we're
She's
gonna
awesome.
we're gonna end this show with that, and if you like this show, we have other shows. We got a lot of good shows. We got the Hive Finance coming on with
Yeah.
Dimitri Nishat. Donald Barrett Report is on Sunday nights from 8 to 9. He brings you all the cannabis news, a lot of controversy, which we love.
Yeah.
Not Your Average Joe Grow Show is on Tuesday nights with Jake Gannum, and that's from 7 to 8 p.m. And then you have yours truly once a week.
Every
Same bat
Wednesday.
time, same bat place.
Yeah.
Right? So we're going to end with this video. Thank you all, and we'll see you next week.